Hey friend, Christina here with NursingSchoolofSuccess.com, and in this video we are diving into the pathophysiology of pneumonia. And if you want more video trainings for med-surg disorders that you've gotta know for nursing school, then you will definitely want to check out the NursingSOS membership community. I have packed it with videos and cheat sheets and study guides to walk you through nursing school step by step. It's amazing. I'm here to hold your hand through nursing school, and I cannot wait to see you on the inside. Now, let's get to the pathophysiology of pneumonia. Alrighty, so pneumonia is a super common condition that you'll see at clinical. All it means is that there is an infection and inflammation in the lungs, and this causes several problems which we will cover in this video. So we're going to talk about the pathophysiology of pneumonia by walking through it step by step. You know me, and you know how much I love steps. Now you won't see these steps anywhere else. I just made them up to make learning all of this easier for you, so just so you know, it won't be in a textbook or anything. All right, so step number one of pneumonia is that there is an invasion. Dun dun dun. So this invasion can be bacteria, a virus, or fungi. It's just a pathogen that sneaks its way into the lungs, and it can actually be caused by an invasion of chemicals or something else that causes just irritation of the lungs as well. For this video though, we are just going to focus on pneumonia caused by a pathogen, because that's the one that you will probably see the most at clinical. So that's step number one of pneumonia. There is an invasion of a pathogen. Now, step number two is that the inflammatory response in the body is triggered. That good old inflammatory response, right? So when this happens, the blood vessels are going to dilate, and the blood vessel walls actually separate and they become leaky. This is what we call capillary leak. So these blood vessels dilate and become leaky, so all the white blood cells can move out from the blood vessels and into the lungs, into battle to fight off those invading pathogens. So that is actually step number three of this process, is capillary leak. Now, step number four is edema and exudate is created. So all that capillary leak, a lot of that fluid is moving from the blood vessels into the lungs, and those white blood cells are fighting and fighting and fighting to get rid of all of those pathogens. So this causes a lot of exudate and debris buildup inside the lungs, all of those dead pathogens and white blood cells. So now there's a lot of gunkiness inside the lungs, all that fluid, all from the blood, and all that debris from all the blood cells and the pathogens, right? So all that buildup. Now step number five of this process is reduced gas exchange. So we know that the lungs are responsible for gas exchange, right? Getting oxygen into the blood and removing carbon dioxide from the blood. But with all of this debris buildup inside the lungs, it can't get oxygen or get rid of carbon dioxide as well as it should. So this can lead to respiratory acidosis because of all of that carbon dioxide buildup inside the blood, which causes the blood to become more acidic, right? And if pneumonia continues and the pathogen enters the bloodstream, this can lead to sepsis. And this is step number six, is sepsis. And sepsis comes with its own set of pathophysiology, signs and symptoms, assessment, and nursing interventions that you might need to do for it. So if you need a refresher on the pathophysiology, you'll definitely want to check out the sepsis patho video that we've got for you on that. So definitely check that out if you feel like it'll be helpful for you for sepsis. And those are the steps of pneumonia. Step number one, there is an invasion of a pathogen. Step number two, the inflammatory response is triggered. Step number three, capillary leak occurs, which is where that blood and fluid leak out of the blood vessels, right? They become leaky. And step number four, there is edema and exudate and debris buildup inside the lungs, and this impairs gas exchange. which is step number 5. And if the pathogen makes its way into the bloodstream, that leads us to step number 6, which is sepsis. Now, I hope this clarified this whole process of pneumonia for you. Like I said before, if you want more videos like this and you want me to walk you through nursing school step by step, if you want me to hold your hand, I'm here for you. You will definitely want to check out the NursingSOS membership community. I will pop a link down below in the description. I cannot wait to see you in there, friend. And as always, if you liked this video, let me know. Write love in the comments down below, and make sure that you subscribe and hit that little bell icon so you never miss a future video that we post here on the Nursing School Show. Thank you so much for watching, friend. Now go become the nurse that God created only you to be, and I will see you right back here next time on the Nursing School Show. Take care.